to date, as of yesterday, we've had 2,686 measles cases that have been recorded since the outbreak. And there were 249 recorded in the last 24 hours. Now, during this period, there have now been 33 measles-related deaths and 1 fatality in the last 24 hours. Currently, there are 193 measles cases who are now being admitted to all health facilities in Samoa. Of this number, 159 are currently being admitted to our main hospital here in Mototua. Currently 5 at Potasi Hospital, 18 at Lurmuenga, where our New Zealand team is, and 3 at the main hospital in Savai. There's also 3 at another district hospital in Savai, Fualalo, 2 at Sataua, and 3 at the Safotu district hospitals. Now the total number recorded for all measles recorded during the start of the outbreak to now is 798. Of that, 572 patients have been discharged and returned home. And from our data that we are looking at, the most affected age group is from 6 months to 3 years. So the majority of these deaths are below 5 to be safe. And nearly all of them, or I am confident to say all of them, were not immunized against measles. We have been pushing our vaccination and continue to strengthen during this proclamation period. And we have now recorded about 32,743 vaccinations that we have been given, targeting the prioritized age groups as you've been informed. Since activation of this, as we speak, we have successfully vaccinated about 33,000 as of yesterday. We were looking at the targeted and the prioritized group. We are still not satisfied with the coverage of the 6 months to the 4 years. We still haven't crossed 40% of that age group. The other age groups are doing steadily, but we are still worried that most of the kids are not coming forward or not being brought by their parents to this. Now, mind you, there have been vaccinations before that, before we even restarted our camp. We started our vaccination in April, and the outbreak was around late August. But we were continuing from there. We even strengthened during the early weeks of the outbreak, which we are now gathering all that data to be reconciled to get an exact or even a more calculated estimate of the current coverage now with the mass vaccination campaign going on. We've also noted that from some of our data that most of these children, that most are being presented late the average number is about 5 to 6 days since the onset of their symptoms and signs. So they really presented late to the hospital, and associated complications are quite high, and most have resulted in death. We are doing a lot of work with, we've got a lot of reinforcement in staff that will be coming down by the end of the week. We are also receiving nurses from French Polynesia, and doctors through the SPC. There will be Pacific Island nurses joining us, and also through New Zealand and Australia. New Zealand is bringing down about 18 new nurses in this weekend. We are not just bringing in requesting for nurse vaccinators. We are requesting also for general ward nurses, ICU nurses, pediatric nurses, who can come and also relieve the workload for our staff. We are also conscious of their workload. We are still also looking at the number of those that are still coming in due to non-measles problem, but complications of diabetes and
Thank you very much. Can I just ask, you mentioned that you haven't got 40% of those young people aged 6 months to 4 years, and that some are coming in very late with major complications. In your mind, Dr. Lassetti, do you think that some parents are neglecting their duty to look after their children?
That's the current impression we have. And we are engaging everyone, the church ministers, the village mayors, and all political leaders to, assist us in trying to encourage the mothers to bring forward their children, especially the ones around 6 months.
Why are they not bringing forward their children?
I am not sure. I am not sure. Maybe the impact of the tragic deaths, that's a year ago. But with the current measles outbreak, most have started coming back. They're coming.
As part of the state of emergency, parents are compelled to bring their children to clinics, are they not?
I think that has also had a big impact on this. Now people are coming in. They know that we are very serious, and they know that this is the only answer to measles. Not only now, but the future.
So what do you say to parents who are not bringing their children in? Is that irresponsible?
I have to bring them in. Mind you, one of the proclamation orders is compulsory. So before we take the law, we have to convince them to come.
The 249 cases in the past 24 hours, from the data I've seen, that looks like a new record in the number of cases, new cases that are being presented over short sort of periods. Would I be correct to assume that the situation is still escalating in your mind?
Well, this number has been fluctuating for the past 3-5 days. But we have increased also the capacity of our reporting. But my own personal opinion, the way I look at it, the numbers are going up steadily.
What does that mean about the epidemic in general? Has it reached its peak?
I don't think it has reached its peak.
Are you satisfied as the head of the health ministry that you have taken as quick action as possible to contain the spread of this disease?
Well, as I've tried to explain before, most of the infectious disease, the first thing you really need is to have your clinical care strengthened. because good care will prevent mortality. And then you start the prevention out into the districts. So with that, and I know that looking at other reports from outbreaks in other countries, we have similar mortalities related to measles. We say most of the measles outbreak in several countries takes quite a toll. So we haven't completed our outbreak yet. So we've yet to look at that. But discussing this with our OSMAT team and some from New Zealand, they feel that this is a similar outcome despite what sort of level of the care is.
Would you have liked to have seen the national vaccine campaign started earlier than it was?
Well, we started in April, and we...
compulsory campaign that started 7 days ago.
Well, it would have been better, but it's a very difficult decision to have a compulsory vaccination. But now I'm very happy. I've heard our government has made a decision that they will make this a compulsory.
When will the 50 years upwards someone can be vaccinated? If they keep on using all those clinics.
We're hoping next week, Monday next week.
So sir, what's your message to parents Samoa has had a very low vaccination rate in general for a long time. You're telling us that parents still aren't bringing their children in. What is your message to them in that case? Because this is clearly neglecting their responsibility as parents, and is there not a way the government can compel them to bring their children in to save their own lives?
Well, if you look at most of our messages on health promotion on TV and on the radio, it's all about the responsibility of the parents and the outcome of having poor choices by not coming in to vaccinate their children. Measles don't happen every year, outbreaks. But if they vaccinate, measles is just one disease out of a spectrum of diseases that can't be prevented by vaccines. And we are also telling them that, you really have to update everything, not just measles.
And just on the nurses, you mentioned new people were coming in. Are you putting out a call for additional help, for additional nurses? Some are coming from Tahiti, we've got a New Zealand team here, but what I'm asking is that enough? Have you got enough staff? Have you got enough equipment to cope?
We have put out a call. This was like 2 weeks ago. Even the first time we started this, when I met all the New Zealand and Australian High Commissioners here, that was our first call. We know that our staff will become tired also. We need specialized nurses, so the call was out.
Yeah, but do you need more now? I know you made the call 2 weeks ago. Do you still need more staff?
Well, we have secured, even all the way from UK, they have responded. WHO Geneva office, the manager of the World Health Organization emergency medical team, we requested him, so he has now mobilized and put up the call on a global level.